I don't know about you, Gary, but I like the tone of this discussion and debate that we just had. It was heated at times, but people are intense about this subject. But this was civilized, and I wish the rest of the country could learn from our PBS performance here today.
I think it was important that Sylvester Turner and Ed Handy found areas they could agree on in terms of problems with the present system. And I think you and I agree the present system is not sustainable economically, morally, for a number of different reasons. And we need change. And probably one of the good ideas that maybe comes from this show that maybe our friends in Washington can listen to is that both parties need to talk to each other and not over each other, and quit playing politics with this issue. The health care of the American people is too important for political games. And the Democrats...
Yeah, there were stories like Sylvester told about the young man who is no longer with us. And I'm really disappointed, though, with Ed Hendy, who I went to college with, so we're pals. But
yes,
to say that an emergency room is an alternative to, covering people through Medicare or Medicaid or Children's Health or whatever it is that we could talk about that might get these 46 million back into some system.
I'd say give them a voucher, let them buy insurance, and have the insurance owned by individuals so you don't have pre-existing conditions or portability issues. And then we start talking what we did, of course, on the other show we had, David. We had the doctors in where we talked about changing how we compensate for medical care. So not for procedures, but pay for outcomes.
And, I did notice that you were jumping on the argument of Dr. Fry, who was trying to tell us that, if we just go back to a completely free market, I'm sure everything would, work out.
Well, that'd be great if we had a true free market in medical care. We don't, because the government pays for, 50 cents of every dollar in medical care in the country or more.
And it's growing.
Unfortunately.